And I wanted to start with what we've been experiencing, and we had the experience, and some of it was bad and some of it was good, which I even saw, while I was coming here, I saw some people are still wearing the mask. And that is a sign that this person is taking a decision that they would like to protect themselves, and that's an individual decision. But I think it's also a fact that this COVID-19, it's gone, but it might happen anytime, and another disaster might happen also another time. So let's start with what have we learned so far, and the lesson learned, and let's hear from all of us here on the panel what exactly we've learned, Your Excellency.
I think most of the people here in the health sector, so they are more capable to answer than us. Before that, how many of the audience here are working in the health sector? Why, Abu Majid, you are from the private sector, but you are working. So if you allow me, I think everyone here, especially with WHO's representatives, can we give everyone here a big round of applause
We should.
of what they did in the COVID period? I think everyone went through this challenge, and I'm sure learned lessons. Most of them, I mean, there is different lessons, different countries, different challenges. But I think we learned to plan properly. We have to have proper strategies. We have to have a resilient system. We have to be very flexible. And I think something very important also, we have to take care of our families. I think I can summarize this in 3 or 4 points.
Excellent. Thank you. Was that the same case as well in Egypt, Your Excellency?
I think we need to remember that COVID is still around.
Absolutely.
We're talking about 677 million of the population being reported as positive cases, and more than 6.7 million lost their lives because of COVID. So we need to remember that all the time, and we need to learn and get from our experience. And I believe, to answer your question, we need to focus more on science and data-driven decision policies. And we need to focus more in research and development. And international cooperation is very important, because what we have seen that no one nation can manage to work alone to solve this epidemic or this health crisis. And we need all to work together so that no one will be left behind. Talking about the healthcare workers, as my colleague was just talking about, we need to give them more attention. We need to build more capacity and train them. Agility and preparedness and flexibility of the healthcare systems in general is very important to focus on, because there is no playbook for COVID-19. So we need to learn from the experience. We need to share the experience that we've learned together in different nations and bring that together to be documented, so that we'll get ourselves ready for any future healthcare crisis. We're not talking about just pandemics or epidemics, but we now see the earthquake in Turkey and Syria. And if the healthcare system is not ready for accepting that, I think this will be also a problem. Engaging the social society and the private sector together with the public sector, because they've done a marvelous job in battling against COVID in different countries. So bringing them together and putting a plan for crisis management, so that we can be all ready for any future pandemics. So I think there is a lot of lessons to be learned from what happened to us. I'm only afraid that we forget as a human being very easy. So how can we keep in mind not to forget this crisis and get ready for any future crisis? Thank you.
Thank you. Dr. Mike, these are two examples, Egypt and the UAE, but I think WHO was actually overlooking the whole world. And His Excellency he started by saying that maybe we need to focus more on research. Do we have the luxury of focusing on research, and is that a priority according to the WHO?
Research and innovation are very important, but just let me begin by reflecting on the earthquake in Turkey and Syrian Arab Republic. I had the honour of spending the last few days in the Syrian Arab Republic. I flew from here on a cargo flight with Dr. Tedros to Aleppo and spent the last few days there. And again, once more, what was reinforced to me is the courage and bravery of communities in the face of crisis. Sometimes we look for external solutions, and we need that innovation, and we need support. We need to build infrastructure. But the people who were pulled from the buildings in Turkey and Syrian Arab Republic were pulled from the buildings by their families, by their friends, by their sons, by their daughters. The surgeons who operated and the nurses who worked were local. We need to remember that emergencies, they begin and end in our communities. And it's the resilience of those communities, and as the Minister said, the resilience of the health system, that capacity to cope. Because in a global emergency, when an emergency happens in one place, and we've seen that in Turkey and Syrian Arab Republic, help comes from outside. In COVID, it was everywhere. So no help was coming. And many countries were left on their own, many communities were left on their own, and they had to cope. So I think for me, the lessons we learn are that we need to focus. There's only two things we do in a crisis, in an epidemic, that we make a difference. We protect communities and we provide safe, scalable clinical care. Everything else, coordination, innovation, countermeasures, surveillance, they make that either effective or less effective. So we need to get our focus back on serving our frontline workers, serving our communities. The small and medium-sized enterprises, and this are the least recognised in this. We talk about the private sector's role in COVID. The people I'm proudest of in the private sector were those small businesses, and as you said, Minister, in our preparation, businesses that were losing their livelihoods and still feeding frontline health workers, losing their livelihoods and still offering taxi rides for nurses to get to work. Those small and medium-sized enterprises are embedded in their communities, and they felt that pain. So I think we have to put our focus back on communities and our innovation. Yes, we need innovation in vaccines, we need innovation in all of the technologies, but we need innovation in how to build trust, how to build communication with our communities, how to build acceptance. It's fine on the tech innovation is very important, but the technology innovation we need is really also around communication, around engagement and partnership with our communities. And sometimes that's lost when we speak about technology, because we see technology as an upstream issue. We need to make innovation a downstream issue in our communities.
I'll stay with you as well, Doctor. Before coming here, we were talking about the set of priorities for the governments and taking decision when there's a disaster. Can you share with me and with the rest of the people here as well your point of view, and then take it to the government officials to answer?
Yeah. I think in talking to the ministers before, it was quite obvious, and I think every country has a unique set of vulnerabilities and strengths. Every country is different. We often focus on the pathogen threat. We focus on the threat of the virus or the threat of the earthquake. But in reality, it's our own vulnerabilities, the vulnerabilities in our population, their underlying healthcare, the vulnerability of the system, its ability to cope. That's where we fail. There's not much we can do about the pathogen. There's not a whole lot we can do about the earthquake. The earth moves. The question is, how vulnerable are we to that threat? And human impact is not related purely to the threat. Human impact is related to the underlying vulnerabilities, and that's across all disaster types. And the Minister said it in his opening remarks. It's about preparing for multidimensional crises, and it's about recognising that each country has a unique set of vulnerabilities, a unique set of threats, and each country must deal with those threats and then work with other countries on common threats.
And with Egypt, with like we have 105 million, the population, and also we have limited resources. How you were able to manage the priorities during the disaster?
That's a good question. I think, as I mentioned, there is no catalog that everybody should follow or can follow during the pandemic. And I believe that Egypt was lucky enough because of the age population, because our 60 and above of the population represents only around 8% of the 105 million of Egyptians. And that gives us a very good opportunity to work with that number as the most vulnerable group of the population. But let me tell you that we worked earlier than that by 3 or 4 years for what we call the health initiatives, where we managed to screen more than 60 million of the Egyptians for communicable and non-communicable diseases. And this is what you're talking about. We made ourselves ready by early detection of non-communicable diseases, managed to treat them, control that group of vulnerable people. So when we faced the pandemic, we had already enough surveillance data to work with in order to protect those vulnerable groups. So you're right. I mean, the resources was not that much, but the government recognized the importance of that area, and we also managed not to lock down. And as I said, if we want to follow other countries like in Europe or elsewhere, we could have just locked the whole country. We didn't do that. We managed to compromise between the health sector, managing not to overload or not to exhaust the health sector by having a lot of cases getting into hospitals, by maneuvering, using university dormitories for isolation, using home care surveillance and follow-up, so that we don't bring patients to hospital unless they are really in need of that. So the challenge was huge. 105 million working with them in a very critical time where there is no perfect answer. There is a lot of infodemic going around because of the misconception and the misinformation going around the media. There is no medication. We didn't receive the vaccination except little later than any other country, which is another important issue that we need to remember, which is equality and how solidarity of countries work together in order to preserve and provide a vaccination in the proper time. So the challenge was huge, but I believe with my colleagues in Egypt, we managed at all times to control and to cope with that challenge in a beautiful way.
So the priorities in the UAE were the same as well, Your Excellency?
Let me go back for the lesson learned I wanted, but you were looking, focusing on His Excellency. So I think also one of the most important lessons was having a clear message. Unfortunately, we saw how social media could ruin whatever you do by someone who's sending a wrong message. And sometimes from also the government or other entities, we have to have a clear message when we send it to the public, so we know exactly what do we need from them or what do we want them to do. Another serious issue is the culture. How can we build this as part of our culture? How can we make people know when to wear a mask, when to stay away, what to do, and certain things. I think we saw it in another pandemics previously, before the COVID, and we saw people, when they go to crowd, they wear a mask. I think we have to put this as part of our cultural responsibility, because culture is the way you live, the way you walk, the way you talk, the way you act. So we want to put this as certain, we need to keep it as an ongoing learning process, so it's become part of our culture. That's what will add. So those two challenges, of course, the challenges are what we learn from. So this is something that we can add to what we learned from. Going back, I know you said keep your answer short. No, that's why I make it very short at the beginning.
No, I just wanted also to add, I think it's important to have also a trust between the public and the government as well. In some countries, we didn't see the trust, and therefore
exactly.
We didn't see any obedience, if you like. But in the UAE, we did.
We saw it clearly how can diversity could be an added value, right, and make it more towards unity. So I think UAE have more than 200 nationality. We didn't have anyone. The moment we opened centers for vaccine, people really, residents, citizens, visitors, you name it, all of them start going, queuing, and taking the vaccine. We didn't have an issue. This could be somewhere else, but I think our government did invest the right way for UAE, and we did gain this, and we benefited from this. So, as I said, challenges in certain areas could not be challenges in other areas.
And your priorities? What's the priorities? Was it education? Was it health? Food?
It depends, as I said. Look, we are blessed with our leaders, as I said. We are blessed by an amazing leadership, and we are lucky by these people, either who are working in the health sector or all whomever. As I said in my speech, it's a certain responsibility on everyone. Institute, individuals, you name it, private sector, public sector. As His Excellency Ryan was mentioning about the private sector, they did play a huge role in the pandemic. I'm talking about UAE. They took a huge burden from the government. They took a huge responsibility. And we have to empower them. We have to support them. And in the end of the day, most of the vaccine came from private sector. A lot of His Excellency Hamid Ghaffar is working on a new initiative on robotic now. Private sector. Maybe he's not going to gain anything from it, but he's trying to help and support. We have now added value Mansour al-Mansouri, who used to be in the private sector, and now he is head of Abu Dhabi Health Authority. So we can go further in this by empowering the private sector, and I think it's very important. The most important thing, as I said, we have to have a proper strategy at the beginning. We have to build a resilient system and a flexible system, and everybody have to play a role in this.
Absolutely. And one of the issues that people might sometimes, and I read some articles talking about the same thing, that we're not prepared, we're not preparing ourselves or taking the right steps for any possible crisis that might occur, which they call it the cycle of panic, then forget. What do you think about that, Dr. Mike?
Sorry. Yeah, we've that statement was around before the pandemic. Certainly, my experience after 30 years doing this, that is my lived experience. When there's an emergency, everyone rushes, everyone makes promises. We won't do this again. We do this in our own personal lives. We have a crisis, and we say we're going to change everything. I'm going to sort everything out by finances, health, and then life happens, and you move on. The problem in preparedness is if you don't learn the lesson, you repeat the lesson. And I think that's the challenge now. Can we actually learn the lessons? I don't think we've learned them yet. People are talking about it. Sometimes I think it's like a unicorn. Everyone can describe it. Everyone knows what it looks like, but no one's ever seen one. And I think that's a problem, is making the commitment to really make those changes that we need to make. I think we need to, for too long, we have seen health and health resilience as a cost in our system. And I feel sorry for ministers of health going into cabinet meetings with their budget every year, because it's not seen as an investment. It's not seen like industrial development. Oh yes, please, let's have more of that. We see health as a cost in our system. And until we see health and preparedness as an investment, I use the metaphor all the time when I'm doing training with people to say, on the 1st of January this year, I didn't go back to my insurance company and ask for the money back on my house insurance and my car insurance, just because I didn't have a crash last year. I consider my investment to have been a good investment, even though I didn't draw down on that investment. We don't see health like that. We don't see the investment in health resilience as an investment in our future protection. And until we start doing that, we're not going to get anywhere. While we run our health systems at 120% in normal times, and then we expect our health workers to be the shock absorbers of the system. And that's what we've been doing. We've been using our frontline health workers as the shock absorbers for emergencies. And you know what? They can't just keep doing it. They simply cannot. And we have to stop this. And we have to invest in a better, fairer system that will then build trust. And the Minister said it and you said it. The biggest missing commodity in this pandemic was not a vaccine, it was not a diagnostic, it was not a drug, it was trust. And the breaches of trust at all levels were catastrophic, between countries, within countries, between sectors, between people, local level. And we've got to reinvest. So I do think that cycle is happening again. It happens, it's natural, but this time around we have got to say no. We must begin and do something different. And I think we are. I think we're going to get there. One of my staff used to call me a pathological optimist. And I think his diagnosis was correct. Right? Because you can't do this work and not have hope. And when you go to the field, I've been in Uganda and Pakistan for the floods, in Ukraine, and you go to Turkey, and you go to Syrian Arab Republic, and you witness the courage and the fortitude and the fierce intent of frontline workers, and you see that, you feel honoured, you feel shamed that you're not able to do more to support them, and you feel honoured that you're in their presence. The heroes of health are not sitting here. Mm-hmm. The heroes of health are today admitting people to hospital, treating disease in emergency rooms. They're doing major crush injury, trauma surgery in Turkey and Syria. They're our heroes, and we are not serving them well.
Well, Dr. Mike, you said that the countries are using the health care as a cost, not investment. I'm wondering if the governments represented by their excellencies here have anything to comment on that.
No, I totally agree. I think looking at the budget for the health sector usually as something that is not an investment is totally wrong. And we need to redefine back again our concept of sustained funding for health project, because we only think about that when there is a crisis.
Yes.
But it has to be a sustained issue that governments should consider during budgeting for the health sector to have something to be sustained. Contingency plan and risk plans should be available not just on time, but ahead of a time so that we can work together. And I need also to mention some important lesson that we all miss, which is attention to the One Health approach. Because all what we've seen and what we were going to see in the future is coming from different aspects. It's not just only about health, but it's about zoonosis, about the environment, about the food security. So there is a lot of players in that respect that we have all to bring them together in order to think about how to prevent and to avoid health crises of the future. So budgeting and sustainability of finance to projects, and I mean, I'm not talking about projects to develop new drugs or new vaccines, but even for capacity building of nurses, of doctors, of improving the equipments in the hospitals, in clinics, and most importantly in the primary health care, because that's something that we all miss. And primary health care improvement will make a lot of difference when it comes to surveillance and information about future pandemics.
What do you think about this, Your Excellency?
I think my dear friends already covered most of the points. Definitely people will panic and people will forget. But I don't think government should forget. Government have to have a clear planning, clearer strategy. They have to document everything they've been to and how to manage this in the future. As I said, having a proper strategy. We did talk in these rooms about disease X at least 1 year earlier. And it was, Dr. Tedros talked about it, I did talk about it, and we had a panel talking about disease X. So people who worked on this disease X wasn't something new. We knew it was coming. When? We don't know. And this is the responsibility of the government, to have a proper contingency plan and be ready for this. Their responsibility is to be ready. Again, also, people's responsibility is to be part of this in supporting and understanding. You cannot have many challenges and you are not ready for it. So you have to participate in supporting your government by understanding their point. And as I said, one of the most important is always the message and having a proper strategy. So as I said, my dear friends already covered most of the things. It's only we need to know that people will forget.
Okay, so one out of 10, how much you feel that the government of the UAE already prepared a long-term emergency plan for any future crisis? Grade yourself, please.
No, I can't, unfortunately. I think people in here could grade, but when you grade the Ministry of Health and Abu Dhabi and Dubai Authority, let's vote how much you give them.
But you're ready for it. What about Egypt? To what extent do you feel, Your Excellency, that you have long-term emergency plans for any future crisis?
I think in Egypt, the challenge is even more difficult, as you can imagine. But I do believe that what we have been through during the last 3 years now on fighting about this pandemic, in a way that we didn't stop our economy during that time. We didn't lock down schools. We didn't lock down universities. So the way we handled the pandemic during the most critical and crucial time was quite fair, provided with the all circumstances and resources that I just mentioned. But talking about the future, I think we are working now on improving the primary health care program in 5,400 primary health care units all over 27 Egyptian governorates. And that will affect immediately and targeting immediately 80 million Egyptians in different rural areas and villages in different governorates. We're working in also decent life, affecting and improving different health sectors, and one of them is the health sector in more than 4,000 villages in different Egyptian governorates. These are all huge mega projects. Part of it, in the heart of it, is the health sector in order to have it ready. I think technology is important, information is important, the digitalization of the system is quite important. It's not as easy as you can imagine digitalizing the health map of 100 million compared to 10 million or 7 million. It's completely different. I can assure you that one Egyptian governorate is 11 million. I'm talking about Giza, for example, or Gharbeya. So we have governorates with the size of 2 European countries at the same time. So the challenge is huge. But again, we're working hard with my colleagues at the Ministry of Health, supported by the government, and mostly supported by our president in improving the life of Egyptians, making ourselves ready for any future health crisis. And I believe we are on the right track.
Your Excellency wanted to say something?
Actually, His Excellency already covered most of the points. One of them was using technologies. Future, and we saw in His Excellency Mohammed Gargawi's speech that AI, and as I mentioned again, it's part of the future. Now, responsibility of the government is how to benefit from this to reduce the cost. Instead of going through many classic ways in the approach, by innovation, by using AI, by using different flexible systems, I'm sure we can achieve a lot of things. And this is what happened in here. The concept of cost is always a challenge, and the budget is always a challenge. They have. Everyone is having this challenge because, again, leadership have to control the resources and the expenditure to make it more beneficial for the country. But the other way around, how can we, as health sector, workers, companies, private sector, in the health sector, how can we be more innovative? We have people from CHOPS here. They invented an artificial womb. This is something that could change the future. So how can we benefit from those inventions? How can we put this into the service of the government, of the people, to come up with better result in a certain pandemic. So I'm sure that AI, innovation, and technology, as my dear colleague Dr. Khaled mentioned, is something that government have to benefit from and have to use and put it as major part of their strategy.
Okay, now let's be also frank about this. Some countries, they can afford to have the technology, and some countries, they consider that investing on technology right now, especially in the middle of the crisis, is a luxury. So I'm wondering, Dr. Mike, what are the examples or things that you've seen during the pandemic and different crises that deals with these issues? At the same time, about luxury or equality, also His Excellency mentioned about equality. Have you seen this? Do we have a code of conduct that everybody is working under the same umbrella?
It's a good question, and I would say that equality and equity are not necessarily the same thing. Sure. And, so we want to focus on equity, which is access to countermeasures on the basis of your need, not necessarily equally. I think bringing this all together from the national level, every country needs a national health emergency preparedness and response plan, long-term, well-financed. For many countries, that's going to need a lot of external assistance financially in terms of technology. Countries can leapfrog. So countries would have, let's take an example of lab technology. 30 years ago, 40 years ago, you would have to build a central public health lab and you'd have to build infrastructure all over the country. You'd have huge rooms filled with machines. Now it's like the mobile telephone revolution. Miniaturization, costs have come down. So it's possible for governments to leapfrog and innovate and create a very effective laboratory network with a much simpler, much more miniaturized technologies with analytics and others built in. So I think there's a way we can leapfrog, but the same function delivered with an innovative technology. So we have to think about that. But we need to, at the global level, and Dr. Tedros is not here today. One should never leave one's boss in the field, but Dr. Tedros is still in Syria and still working on cross lines and cross-border issues there. But his vision for a framework for the world is to build from those national plans. But for those national plans to work, we need a new accord globally, a new set of governance and financing that will drive that, a commitment for the next generation, not a commitment for the next year. This has to be a generational commitment to preparedness.
And what are the challenges you're facing to reach that level?
In a couple of weeks' time, the member states of the world will come together in Geneva, February 27th, and they will begin negotiating a zero draft for an international pandemic and health emergency treaty or accord. That will provide a framework within which all countries can collaborate over the next number of years. We need better governance, we need better financing in order to develop the systems, the tools and the workforce that we need at local level. So national governments need to work nationally, but we need to connect those efforts globally. And especially if we think about fragile, conflict-affected and vulnerable countries right now. There are hundreds of millions of people living in those contexts. 80% of high-impact epidemics are occurring in those countries. So there is no protection in protecting yourself. We've seen how these diseases move. We are as prepared as the least prepared country. That's the reality. So unless we work, governments have a primary responsibility to their own citizens. And that's very important, that governments retain that primary responsibility to their own citizens, but that responsibility to one's own citizens must now include a global view. In order to protect my citizens, I must have a global view. So protecting the nation is now about protecting everybody. And in order to do that, we need that accord. We need to get that agreed between our member states, and we need to build the financing systems like the Pandemic Fund, which has just been created. And we need hubs around the world that can do different things. We have a new intelligence hub in Berlin, WHO hub funded by the German government, working on pandemic simulation and predictive analytics. We have the logistics hub here in Dubai and the UAE. All of the aid going in from WHO right now into Turkey, into Syrian Arab Republic, is coming from just up the road at our global logistics hub. We have hubs for training emergency medical teams now in Indonesia and Ethiopia. We have a biohub for sharing samples around the world in Switzerland, where we need to use the platforms that countries have. When people talk about the World Health Organization, we're a bunch of shiny-ass bureaucrats in Geneva, That's the reality. We are not the World Health Organization. The World Health Organization is the nations of the world taking care of the world's health.
Right.
And that is where the ministers and the prime ministers become very, very important. We need a new promise to the future, and we need to keep that promise. I don't remember the words in Arabic, but when you make a promise, you use certain words, and you mean that promise. We need to promise the future that this won't happen again. And we need the leadership of governments to make that happen, and we need an accord to enshrine those commitments in international law.
Thank you very much. I think now we'd like to hear from you. What's your promise? You told me about the AI as well, but I want the promise.
I was just wondering, imagine that WHO have enough resources to utilize the info they have from all over the world, going through AI and predict what will happen. It will make everyone's life by far easier.
Yes.
If we put all the info we have, WHO have the access. Unfortunately, they don't have the fund. So imagine they have access to all the info all over the world, coming in one place, using a proper AI systems that will predict what will happen and where it will happen and how big it's going to be. Imagine this. So if there is a promise, I can promise, because I do understand that, and I'm sure that our leadership is always supportive to this. We will support the maximum we can. It's not me, it's not the government, it's even the people in here. Let's deliver this.
But you mentioned also the money, the cost as well. Some people can predict and work on AI, but also the cost. That's another challenge that would face what the WHO would like to achieve.
We saw how the private sector collectively came up with a vaccine within 3 months. They can do it, for sure. It's always the right approach. There is always challenges because, it's political. I don't want to talk about that. But in the end of the day, if the cause justify what's going to come out of that, I'm sure this can be funded easily.
I hope so.
So let's work together into delivering this from here.
I hope so. Last word for you, Your Excellency. What's your promise and how prepared are you to go to the meetings that Dr. Mike was telling us about?
I think we have to count on the WHO and other international organizations more than now. Let me just ask some questions that need a lot of answers, and we didn't reach any answers so far. We learned from the 3 years ago that there is a different response between people in different countries to the health part of the pandemic. Where is this information? What happened to Egyptians in going to the ICU or needed a vent or in different areas in Japan or in China? Who will gather this information to bring down the experience of the whole globe to be available and accessible for AI and for algorithms and for the new technology to start working and teaching? We have to learn from the experience of each other. Who will do that except an international organization like the WHO? We're not talking about funding here because I think the funding is not a great issue when it comes to that major task. But we need to have that quickly as possible so that we can bring our staff, train our nurses, train our physicians, train our health systems how to be agile and how to be flexible and resilient and learn from that mistakes. We have been through swine flu, the MERS, the SARS, but what did we learn from that? What kind of information is available on the cloud or even in countries to use it as a template, as a model for learning? We didn't have it. So again, we are afraid that we comes to a day that anything will come and then we'll face it as if it is new, as if it is the first time. That's what we need to have, and that's the responsibility of an international organization like the WHO.
Well, thank you very much.
Could I just add to that, just because we are building that pandemic simulator, and we need the member states to work with us on that, but it needs a brain. it needs the algorithms, it needs the AI, and we're looking at that right now.
And you need to have access as well.
Yeah, but the issue is not bringing the data. Now we have APIs, we can go find, it's access to the data where it is, it's building those scenarios, because when you build a simulator, you can train people, you can do scenario-based planning, you can predict the future, at least futures. It's not a predictor, but you can look at different futures, bringing that data together, and that's what we're doing through the hub in Berlin. But there are huge collaborations starting around the world with different entities, public and private sector, on that. So I invite everyone to join us in this endeavour. But we also need those hubs for logistics, like we have in Dubai. We need those hubs for training. And we need to rely on our member states to go beyond the nation state and build those international hubs that allow us all to benefit from the lessons.
Absolutely. I know that this topic is very important and we need to prepare ourselves for the future and for any possible crisis, but I think we're running out of time now. Thank you very much, my panelists, and thank you very much for the audience.